all very much for being here, and we've asked you all to sign in. If you haven't done so, please do so, and also release form, because we will be taping and audio recording, video and audio recording the session so that we can have it on an archived basis for anyone who cannot be here. We're very, very honored today to have Dr. Natalie Desmarais. She is a licensed clinical psychologist specializing in health psychology. In addition to her doctorate degree, she has attained a master's degree in clinical psychopharmacology and mental health counseling from Nova Southeastern University. She is also board certified biofeedback specialist. She became a licensed here in the state of Florida in 2009, has worked in private practice, medical hospital settings, and college counseling services. She specializes in anxiety, depression, behavioral sleep medicine, relaxation therapies using biofeedback, and compassion fatigue burnout. Although she was formerly trained in cognitive behavioral therapy and humanistic psychology, in her clinical work, she incorporates interpersonal acceptance and commitment and mindfulness-based therapies. She is an assistant professor for the Department of Medicine, Family Medicine, and Community Health, and her research interests include mindfulness and biofeedback utilization and empathy and burnout in medical professionals. She's going to be talking to us about healthy boundaries today. And just to remind you, on August 16th, we have a summer break now for our ongoing faculty development series. But our next one will be Wednesday, August the 16th. You will all be notified of that. And it'll be Dr. Von Harscher on burnout, empathy, and empathy in medicine. Thank you very much.
Thank you. All right, so today we're going to be talking about healthy boundaries. Initially, when I started looking in the Lit Review for this topic, what I found was a lot of articles related to undergrad faculty, not a lot in regards to medical education, but I did find a few articles which will be referenced. I did not include the reference in the slides, but if you're interested in getting a copy of the articles, I will be very happy to provide that for you. So getting to know you guys that are sitting in here, right? Simple poll, before we even go into the details of this important topic, I think, that isn't very much spoken about, I find, in a lot of articles, a lot of research out there, as well as in the community, the university community. How many people here, and I can actually tell you guys, are faculty? And non-faculty? So we got it's on that, right, except for Leslie, right?
I'm like somewhere in the middle, faculty administrator, so it's not one or the other.
And then for the faculty, how many years have you been faculty?
Here or
Years in total.
40 months.
Okay. And then in terms of how many here at HWCOM, how many years?
24.
Okay, so you're definitely someone that we can refer to in regards to some of the challenges or the conflicts, potential conflicts that can come between faculty, student, as well as staff, right? Non-faculty and student. So primarily the focus on this presentation is truly faculty and student relationships, but I think we can interchange staff as well, because you do work a lot and very closely with the students, correct? So let's get an idea of what you all think are healthy boundaries. Like, what is the idea in your mind of what a healthy boundary between a student and you, be it faculty or staff? What are some elements of a healthy boundary with students?
Not providing healthcare.
Not providing healthcare.
Yeah. Respect.
Respect. Okay. Meaning respect from students, respect from mutual respect. Okay. Trust. Feeling that you can, one, have trust towards the student as well as the student have trust towards you, correct? Absolutely. Any other elements? Because these are stuff that we're actually going to be highlighting in today's presentation. I have about a 35-minute presentation if it's just me. I'm hoping that it's going to be longer by the discussions that you guys bring into the table.
So Natalie, what is a healthy relationship or boundary? It's blurred. It's different now than what it was when I was a student, because they have my cell phone number and they know to text me when they're done with their notes in clinic so that I can sign off on them as quickly. So electronics and technology have led to a blurring. With the household visits, it was like super blurred. They were in my car. And like could see like you can't hide your car from people, but so it was a very different relationship.
Absolutely. So hopefully we talked about social media a little, but definitely, I mean, times have changed, particularly how we communicate with one another and how students reach out to give you confirmation of certain things that they've done. So how do you kind of know, well, what if a student all of a sudden texts you and says, I need your help with something? How do you, those questions kind of can put that.
But you can limit the budget, not giving them your cell phone number. I, on the other hand, give it out to everybody, including patients. I have no problem. That's how you communicate.
Yes, these days that's how you communicate. But is there an issue with that? Yeah, is that causing some potential issue?
Some crossing boundaries.
I think you set your own boundaries.
Yeah.
Mm-hmm.
That's what you do. You set the boundaries.
You set the boundaries.
But when you say trust, Natalie, so that's a complicated area, because is there such a thing as too much trust, for instance? The other is, your questions framed you, what do you think healthy boundaries look like? And that's one way. I was also trying to think of what happens when you don't, like, can you define that by talking about what happens when boundaries are not healthy?
Yes.
Like, what is it that we're trying to prevent,
Correct.
essentially, if you wanted to see it,
Absolutely.
in a negative light, but still.
And we're going to definitely go. I actually have some case vignettes that we're going to hopefully have a chance to discuss.
Great.
So it's in essence from the lit review that I did, and again, I'm a clinical psychologist. I live in the world of very strict boundaries when it comes to patient care, as well as student. Also, the patients for me are students. Now, that doesn't mean that they don't have my cell phone should there be an emergency, because I value that ability for them to know that I'm there for them, right? So again, the phone communication can come up, but in general, most professionals have a very good sense about boundaries and the importance of upholding those professional boundaries with students. So hopefully, again, today we can talk about those potential conflicts that will cause healthy boundaries to not be understood, per se. So what is a student? In the lit review that I found, obviously they are learners. We understand that's common sense that a student is a learner. But if we also think about it in terms of the longevity of their profession, of their career, your connection with them, the mentoring aspects, they are a junior colleague to you as well. And so we have, one, the student has multiple capacities, but we have multiple capacities with them, right? They expect faculty to, one, acculturate them into the profession, right? Not just teach them the material, because that's an aspect, learning is definitely an aspect, but also to receive an evaluation on their knowledge, on a particular skill or skills, and then also on professionalism, right? And these are everything that faculty does. In terms of staff, how do you think, what is a student to you? Because I'm trying to make sure that I include you guys in this conversation.
Reliability.
Their reliability.
Yeah, because we're in student program, so when we're working with students, we expect them to come to a lot of the things that we put on.
Okay.
To be present in that.
Okay. So that's where that idea of trust and right comes from. Okay. So students are dependent on us for our willingness to teach, mentor, and also of our fairness of the evaluations that we provide to them. I don't do evaluations, so I'm speaking on your behalf as faculty, but they are vulnerable to us, right? And we're going to talk about that unequal relationship that exists between student and teacher. But first, let's operationally define what a faculty member is. So a faculty is anyone with an assigned responsibility for teaching, precepting, guiding, mentoring, or evaluating students. Again, that multiple role, multiple capacities. So in addition, faculty also focus on concerns with the teaching context that they are in, right? Looking at group morale, possibly images and appearances of the students, and even students' perceptions on the learning context that they are in. So guess what? We're vulnerable to students, right? Do you think that it's an equal vulnerability on both sides of the relationship?
Not even
No.
close.
Not even close, that's right. I actually watched a video that you provided through family medicine. It was on healthy boundaries and professional identity. And one of the presenters talked about the primary and secondary roles that faculty have with students. So what would be examples of primary roles that faculty have with students?
Teaching.
Teaching, yes. Yes. Advising, right? Mentoring. All the things that we kind of listed earlier. So what is secondary roles then? And this sometimes might come into play with you guys as well. Secondary roles.
Well, noticing a student in difficulty. I have had a student like that I've had to refer to you because I recognize, wow, they're having a really difficult time, and it's not just this. It's like stuff outside in other areas of their life. So I think that's a secondary role, but it's very important role.
Like a wellness supporter.
Right, to
Right?
notice their red flags and be able to help them with those issues.
Absolutely.
Provide the care, but refer them appropriately.
And that is an example of a healthy relationship.
And also mentoring can also be a secondary.
Yes, please.
Not necessarily, unless you're the formal mentor for that student, all faculty mentor students in whatever area they come to you. They usually ask you for advice for a very simple reason. I mean, first of all, the way I look at students is these are mature college graduates.
Yes.
If they weren't in medical school, they'd be a college graduate out in the professional world. So we look at them as students, where in the real world they're looked at as professionals.
True.
They have a
Very
degree.
true.
So I think sometimes we need to do a little bit more of treating them as such as we prepare them. Now, having said that, there are a lot of them that are college graduates without the mature part.
Yes.
But, giving them mentoring in different aspects of life.
Okay.
When they come in, a lot, I give all the students my cell phone number. Rarely, if ever, they use it, just like my patients. But what I want them to know is that they have access.
Absolutely.
That they are the priority, as is set the priority at this university, at this college.
Right. So there can't really be a strict line in the sand in regards to not contacting you. Should they need you, accessibility.
That's the whole idea.
Yes, and that's what secondary roles are. Yes.
I've had a very similar experience to Dr. Greer. I mean, I've always given my cell phone out, even when I was in the state, to 16,000 employees, I gave my cell phone out. And I really never had any issues. Like I think what he said, you set your boundaries, and I was never inappropriately called or.
Great. So what I'm hearing are students take their roles as students quite well. They're serious about it. They're responsible as well, which is good, right? But there can be possibly some conflict when there's one or two students that might kind of push your boundaries with them, and that's yes.
I do want to say, as a household visit faculty, I had my boundaries extremely pushed, even though I set boundaries. But and I have no problem with 3 a.m. emails. My phone's in another room, but the calls at 9, 10, 11, midnight about household visits that were the next day, and students' concerns about that, and not just our medical students, but nursing and social work students as well. Those were serious issues that I needed to deal with.
And would you mind sharing how you dealt with it?
Well, it often was not the same student over and over again. They were many students, and the same factors though. They had household visits that needed to get done by certain time limits. They were very worried about that. Maybe they had just heard from their household member and it was 10 p.m. and they wanted to check in with me about, well, should we do the household visit the next day, or those kind of issues. And in my mind, I'm like, I just want to be with my husband and not think about work right now.
So there's not an extreme lack, but there is some lack of respect for
Well, I
personal
don't
life
think
versus.
they didn't respect my life. I just don't think they understood that I
That you
wanted
have
to
a
have
life.
one.
Right.
Right.
And maybe that's the maturity or developmental.
I mean, after 36
place
years
that
of
they're
marriage,
in.
they can call me anytime they want, really. No, but I mean, I look at it as either you're accessible or you're not accessible. And you set your boundaries with them, and you tell them at the beginning. Like I tell faculty, don't CC me on the email. I'm not going to read anything I can CC on. I'm not interested in these chains with all these things going on. And if it's an email that's important, call me. Because I don't sit in front of my screen all day long and I'll read it. I much more prefer verbal interaction than I do electronic interaction, because you can express very clearly on both sides what you want to say and what you're going to do. And what is considered an emergency for a student, we might not consider an emergency, but it's still an emergency.
Yes.
And so, you know.
So delineating the boundaries verbally and making sure that the other person's
If
in this
I'm
place.
on vacation,
Uh-huh.
I don't take my phone. I just don't. That way I don't have to deal with it.
We're brave
So
souls.
I just want to point out that in both situations, what we're talking about here is our phones and communication and electronic
Yes,
communication.
correct.
And as the mother of a now 20-year-old daughter, you know, I think obviously there's a generational issue here.
Yes.
Because my daughter thinks that I should be able to immediately respond to any text message that she sends, you know, whether I'm in the shower, whether I'm in a high-level meeting, whether I'm here or there. It's taken me actually a few years to get her used to the idea.
I bet you it's not reciprocal though.
Right.
You're right about that. You're right.
Yeah, well, you know-
Although I do have to say, she most of the time replies, because
To
for her
text.
to do a text takes 2
Not to a call.
nanoseconds, not that long.
Not to a call.
But anyway, so I mean, I think for this stuff, there is an issue that has to do with just being very clear from the beginning and anticipating that if you're not, you're probably going to hit some walls, because
Yes.
they, you know, they are going to. But 9 or 10 at night, I mean, of course I'm on my phone. I'm on my phone until I die, and so.
Dr. Rowley?
Yeah, no, I was just gonna comment on something that Dr. Greer said about,
You're
I
gonna
would,
call me Joe.
well,
Setting boundaries.
I looked at my birth certificate, there's no doctor.
Really?
okay, Joe.
If you were Jewish, it would be there.
I normally call you Joe.
Or
but this is a
Esquire.
different situation.
Or Esquire, yeah.
And I would rather pick up the phone and call somebody as well, but I think there's certain times when it has to be documented in writing, and if you don't have that email with regard to a certain situation, then I think things can obviously be misinterpreted if they're in writing, right? The tone and et cetera. But the facts of the thing cannot be misinterpreted if they're in writing, but if you tell somebody on the phone and then they tell somebody else, and that's really not what happens. So I think sometimes the documentation by email is
It is
actually
important,
very
I mean, the way I
important.
handle that is I
Yeah.
just tell them, please email this to me.
right.
If it's something
okay.
I don't wanna have discussed on email, my
Right.
response is very simple,
Right.
2 words, let's discuss.
Right.
Great boundary setting.
Yeah.
That's great.
No, I agree.
These are great examples of how to ensure that there is no, or there's limited gray areas in the boundaries, with students particularly. So, I came up with this table, well, chart, or whatever you want to call it, just in tidbits from the different articles that I read, and really these highlight the fact that there are specific elements of the faculty-student relationship, again, staff as well. One, we talked about it being an unequal relationship. There is a certain level of closeness between teacher and medical students that needs to be there, be it for mentoring, be it for just acculturation into the profession. We want to enhance the learning environment for the students, so what's important to recognize is that every relationship, be it personal or professional, there is a balance between distance and closeness. You know, not if you're married, if you're with someone, you're not close constantly with them emotionally, verbally, physically. There is distance, and that what creates a healthy relationship for that personal spouse or significant other in your life, right? Same ideas with the relationship with students and faculty, staff, student. We have to have a balance between closeness and distance. And when Dr. Greer talks about
Joe.
talks about those direct settings of boundaries, that is a perfect example of setting that distance, but also showing, hey, I'm here for you, and accountability for them. That creates that healthy boundary. So great example.
I have a question. Has anyone here experienced or seen a situation where a faculty member or a staff member sets distance, quite some distance, and it still is a successful relationship? It works out, or has that not been your experience?
What do you mean by how big?
The boundaries is somebody who is very limited, who says, no, you can email me, you cannot call me. Have you ever experienced that works?
But when I'm on the other side, when somebody says you can just do this, I generally do neither. If you're not interested in, you know, if you're gonna give me strict rules on how I can communicate with you, you know, I have, you know, I'm not saying everybody, but I personally have an issue with that. And I try not to treat people that way either. That's just what, I will tell people, no, this is not appropriate at this time, or this is not appropriate there, but you can still do this, or you can still do that, and things of that nature. I think that, especially when you're in an educational environment, you can't put that big of a distance. Not because, these are not high school students, these are not undergraduate students, these are already professional students. So they have to, they know professionalism, and if they don't, we need to teach it to them.
So then do we have to be willing to evolve? And I'm happy to be an open person and somebody who's personal with students. But so then are we saying that we're willing to evolve with technology? Because when Libras existed, we didn't have to worry about somebody texting or calling. You know, so then we're saying, okay, well then we're also going to evolve with technology. And as technology advances, then we're going to have to say yes.
We do have to evolve with it, just like when the printing press came out.
Just
And
like
there were no
the-
longer somebody just screaming out the news.
Do you remember that?
They were happy.
I actually have that first edition of the Bible at Gutenberg Press, okay, so it's really nice. It's not complete though.
So what I'm hearing is there is no set guideline or guidelines that can tell faculty or staff how to maneuver a relationship with a student, right? And that's why in the literature, it really, there is, very rarely is there consistent messages or clear messages in regards to those guidelines, because it is a personal decision as long as the intent is to keep a healthy boundary, right? And what's healthy sometimes, Matt, is individual to that person. Yes.
Well, what I was gonna say is, you know, so Joe has said they're all professional students. We deal a lot, obviously, in student affairs with undergrads, right? Because they're person trying to get in to medical school, and there, I know we do set boundaries, like, no, you can't just walk to my office and expect that I'm gonna talk to you about your application. No, you know, please email me, let's set up an appointment. So we do tend to make, I think, and you probably find that too, more boundaries with the thousands of people who are trying to get into our institution.
Right, but you're not trying to acculturate those students into the profession that they're now into as medical students. So they're
it's a different.
These are the ones that are trying to get in.
But they're trying to get in, but
so
we
there
have
you
to
can
set
set
boundaries
boundaries.
with them, and even other students who might be in the medical school. That's like, okay, there's different ways you can ask somebody in an email for things. In other words, I've had conversations with people, this is, you know, I'm certainly willing to help you, but this is not the way you ask. You
So
know.
you're kind of giving them a lesson in
Yes.
in some regards. So again, the importance of this slide is really to emphasize how we need to be close to our students, but then also set a guideline for ourselves as to what is healthy for us. So they're not contacting us in the middle of the night, you know, about an assignment, right? So a lot of the examples that are up, these are examples from the articles that I looked at, and I don't think that they're necessarily applicable to us or you faculty, because these are basically resident examples. So a lot of boundary issues from the literature review that I found was in regards to, you know, when students are really working closely with preceptors or in their residency. So for example, so I changed some of the words because this might happen. Maybe during third year, a student is really, you know, taken under the wing by one of the preceptors, and in the middle of the rotation, the attending physician asks the medical student to join the physician and the physician's family for dinner at his home. As they sit down, the physician asks the student to give thanks. So there's one, could this happen? I mean, is there a rule, does HWCOM have a policy or rule in place that a faculty is not allowed to invite a student to their house? No. There
Which
is,
I think would be horrible.
why?
Because my experience as an undergrad in medical school, we're getting to know faculty in an environment like that.
Like
you know, there was an environment, because you were treated as a professional, and you acted as such too.
Okay.
So
But did you go to faculty members' homes by yourself as the only student there?
Have I ever been invited? Yes.
as when you were a student or a trainee?
When I was a student, yes.
So you
As a
would-
trainee, also, yeah.
Right.
I was very close with my attendance.
I have too, and I've invited students to my home, saying,
individually.
yes,
I
yeah.
usually invite groups.
Yeah, usually I invite a group, but like if I have an advisee, I'll sometimes invite them individually, yeah.
So again, so let's talk about the risks and the benefits of such an event, of a student coming to a home individually to have dinner with you as faculty, because you're serving as a faculty, right?
No, I want you to know it's just not me and the student.
Right, it's your family.
Right, well, my wife, my kids both.
Okay.
And the dog, the dog.
Are there any conflicts with that? Could there be?
Did it ever come up, maybe from your peers, that you maybe showed favoritism to a specific?
It depends who you're inviting and why.
Okay.
You know,
That's
there's
how,
a
in
lot.
my mind, that just like,
And we're going to talk
it
about
just looks like maybe like this individual, this attendee, this faculty member in an advisee setting or in a teaching setting might grow favoritism if that individual also grades a student, how that can be seen.
I would never invite a student over that I was evaluating.
that you're
Because that's
Right.
the problem.
Because that's a
Yeah,
conflict there.
yeah.
Unless I invited the entire class, which I have no problem doing either.
Right.
You know, the conflict that I come into personally is if I am to invite students, I'm the faculty advisor for a club, and I want to invite them over. Can I invite them to my liquor bar? They're 21 years old, they can legally drink. You know, that's the boundary that I might have wine with dinner or something of that nature, but that's the boundary that I don't cross, only because I haven't resolved that in my own head.
Absolutely.
Because I don't know if one of these kids has a problem with alcohol.
Right.
I'm a liver specialist, I can use the business, I mean, don't get me wrong. So, and then there's self-interest involved in that, but that's the one where,
Yes, where it gets, I mean, it sounds like you have a set standard for yourself not to cross that line when it comes to alcohol, which makes sense. Role modeling, right? I mean, if you get sloshed at the bar with these kids at your house, how are they going to perceive you later on?
well, the one thing I never do, because I just don't do it, is I don't go out and socialize with students.
Right.
I won't meet them at a bar or anything like that, even if it's a celebration, I just don't do that.
How did you
Just
come
'cause I
up
just
with
don't do that,
standard?
what?
How did you come up with that guideline?
How did I come up with that guideline?
Yeah,
Well, I'm not
so-
gonna do it with my wife, what am I gonna do it with you for? No, because that's their time to socialize, and plus, if I show up seriously, I look like their grandfather. You know?
Dr. Goofy?
You mean, well, mostly looking at that vignette in particular, you know, there's the issue of the fact that this person is evaluating the student. I do, you know, the giving thanks obviously creates pressure on the student to perhaps participate in something that is not consistent with their own practice. I think, you know, I do think that there's a strong argument to be made for when you do have students over to your home that you do have them in groups. I mean, you know, as a physician and as an OB-GYN, you know, I have had 2 experiences in my life where I really totally misjudged a patient's, I'll say, sanity, for lack of any better way of saying it, and people interpreted something that happened in my interaction with them as an OB-GYN as something that it totally wasn't. And I was so grateful that in both of those instances, as I always did, I always had somebody else in the room or a chaperone or somebody like that. You know, I've since learned that there are psychiatric diagnoses for people like this, but anyway, so that's, you know, and I'll be quite honest, I'm a lesbian. So, and I realize that the newer generation is less prejudicial than my generation, but I would have trouble inviting somebody over, you know, who could make something different of my lifestyle than it really is. And so I would want to have more than one student in that group. Yeah. And I have, you know, I have had like a group of clerkship students who are interested in going into OB-GYN and that kind of thing. I mean, I've had people over. But I would feel vulnerable having only one student over, honestly.
When do they become not our students? So this is kind of an interesting question for me. One of our former students who's finishing up residency got married recently, and I was invited to the wedding. And I went with my husband, and it was a completely social event, and it was lovely. and I felt very okay going to that, and it was wonderful in terms of just getting to check in with them again. But they all were still calling me by my title. I'm like, not the doctor tonight. Like, I'm like, we're all doctors in this situation at this point. So that was kind of an interesting interaction.
Absolutely. So the student had graduated doing
Many
residency.
years, yes.
Many years. What happens if a student who is getting married, who has a favorite teacher, invites that faculty during an evaluative time? Can a faculty member go? I mean, sure.
Yeah, I see no problem with it as long as the boundary is drawn.
Mm-hmm.
This is an event where they are getting married, you're one of many.
Right.
Yeah.
Yeah.
But I think if it's.
But if you're evaluating them,
If you're evaluating them, right.
Even if, then postpone the wedding. I mean, there's options out there, you guys, but.
I mean, it's similar, like,
Easy.
for us, psychologists, you know, there's very clear boundaries in regards to going to any of those types of events. If the answer is unfortunately no, due to our rights, you know, and protection for you, to not bias the relationship that we have. But obviously that's more of a clinical relationship, therapeutic one. Students aren't necessarily your clients, right? The next vignette is out of the, again, presentation that Wendy was so kind to send to me. And this is, again, from a residency program, I believe it's a family medicine. So Fernanda is faculty, and Rebecca is an M2 who is also the, I changed it a little. I actually modified it. Okay, so Fernanda is faculty, and Rebecca is an M2 who is also the president of the interest group that Fernanda oversees. So because of that relationship, they work very closely together, and as the relationship grew, they learned that they were both single parents. So single parenthood is very difficult. They learned that they were in the same neighborhood, so they became a little more close after, you know, school, even though the faculty was no longer evaluating them, but still an M2, so there might be a potential course that...
I think there's a gross crossing of boundaries when you go on social networking with students.
Okay.
I mean, that's one very strict rule I have. I mean, one thing only LinkedIn, I don't even know how to use it, but I would never accept something from students.
Even on
Or
LinkedIn?
someone that's reporting to you, someone that you're
The rule
overseeing.
is black and white for me because right there, you don't know what's gonna be communicating or anything of that
Right.
nature. It's still, a social network is a social network,
Yes.
period. And so I would never, ever cross that line. And I don't think my faculty should either. We're not there to socialize with them.
No.
Even if you invite them to your home for something, it's not a social event. It's a social event that's wrapped around something that you're trying to teach.
That's educational.
So you seem surprised by his
Oh,
his answer.
LinkedIn actually, at STFM conferences, like that's the one
No, it might be, but
network
that's,
that is like appropriate to check in with students on, because when they graduate, you can still have like some continuity there, as opposed to Facebook, no, like other venues, absolutely not, but LinkedIn is like thought of as appropriate.
by some. I have some professional friends of mine that think it's totally inappropriate. That they're out in California and they have completely gotten off it. All I do is either, I don't even know why I'm in it, because I barely know how to use, I don't even know how to use SharePoint. So I just learned how to download an attack.
You're changing it all right now,
You know, are they changing it over yet? Okay. But I mean, I really think in social, any social network is a social network. LinkedIn claims itself to be a professional network, but some messages that people are not very professional.
It's turning into Facebook.
Yes, it is. So, you know, the technology's the same.
Right. So I'm guessing no one here is friends with students on Facebook or Instagram.
I'm friends with former students.
Yeah.
A former student is already where I
Yeah,
agree.
former favorite students
Yeah.
I'm friends with.
Uh-huh.
Yeah.
I'm friends with lots of people on LinkedIn, including, but mostly it's been people who graduated from here, you know, sent requests.
Yes.
I think one of the things with social media, when you start talking about like Facebook and LinkedIn or even like Instagram, which I know is, you know, it's like the Facebook Lite, so it's not as like, you can't do political stuff as much on Instagram as you can on Facebook. But it's one of the things that you mentioned in the previous slide is that crossing over of boundaries happens very slowly, and you really can't tell until it's too late. You know, when something whether it's somebody saying that there's a preferential treatment because of this close relationship, and maybe there isn't, but it's the perception of one. And when you get to that point, it's almost like where did this go wrong, and it's hard to pinpoint, right? Because you may, Facebook leads to conversations about things that may not have to do with medicine or the behavior of a student doctor or mentorship. And so, it's very difficult to come back from those discussions or those situations and say, okay, now we have gotten very personal here, but now we can't anymore. You can't talk to me about that. And we can't discuss these things. So.
And you have to remember the students and residents are extremely vulnerable.
Mm-hmm.
They're exhausted, they're stressed out, they generally are away from home. Many might be in a place for the first time, so, that leaves, you have to be very careful on how you do that. We're not their parents.
Right. Yes.
That we are their peers though. Mm-hmm. We're both college graduates. And they need to be, I think that they need to be treated that way. The reason being is, how can you reprimand somebody for doing something wrong unless you treat them as a professional should be treated? So I don't look at it, I look at it more like this. I mean, there's no relationship even in a marriage that's equal. Nothing is equal. I get I'm like 10% of the important person in my family, and my wife gets 90. And then my kids share the 10% with me. But it's also that it depends on the situation. There's might be sometimes when I'm learning from the student.
Mm-hmm.
The student might be giving me experiences or things that they have that I was completely unaware of. When they talk about different things. So all of a sudden now I'm the learner.
Right.
But from the student's perspective, also, an evaluator. Even though I don't evaluate that much with the rest of the faculty does that, but I think that it's just like in professional life. You have boundaries with your peers. It's just like in chairing a department, you have boundaries. You hire a professional, you expect a professional to act as a professional.
Right.
They have gone through their education, but now there's the post-education when you go through these things and you learn these different things. And you have to do that. But I mean, so that's the way I do it. It's do I party with faculty members? No. They're like 30 years younger than I am, and I'm in bed by 8:30.
But that's not really why.
No, but it's not why. It's because if you're in a position where you hire and you fire, you can't become buddies with somebody, because that's going to affect your evaluation.
Right, perception, right? It always goes back to that. Yes.
So, potential issues, I have an M1 that lives in my apartment building, my condo. So every now and then I see him in the gym. And that's weirds me out. Because that's my downtime. And I didn't even realize he was a student until I saw him with that FIU College of Medicine shirt. And that's a weird situation. So I've noticed that I've actually avoided the gym more.
Oh,
and I'm going to the park more. And there are actually quite a few students that live in this tight little area. But at the park, I don't know, it's different than in the gym. There's something different about those two venues.
Has he approached you?
Just to say hello.
Oh, okay.
Yeah.
And why do you think that it feels weird for you?
Because it's my turf.
It's your turf.
Yes.
But it's his turf also. But it's theirs also. But that's the excuse I use, though I don't work on.
Well, hopefully, making adjustments to your schedule, or maybe he won't go too often once he gets, in the chaos of medical school. Right, and then you can get back to it. So, just really quickly, I reviewed again the articles and listed some of the potential issues. Two of them listed in the PowerPoint. The first, mistreatment of students. This is really out of LC&E, in regards to the learning environment. So, belittling a student in a group setting, obviously discriminating on the basis of gender, race, sexual orientation, sexual harassment. And sometimes, some examples from especially one article indicated that some resident trainers ask students to do personal errands for them. Did you ever experience that in your training?
It's a very common practice.
Go get
I mean, it used to be a very common practice.
Talk
It's
about
much
boundary
less so.
issues. Putting the students so vulnerable to this person that's evaluating them, right? And then how. So luckily we don't do that here, and that's good.
Hopefully.
Hopefully, right?
We don't know.
Hopefully you guys, right? Excessive or inappropriate closeness. So we talked about favoritism. So favoritism, the student, you'd think that if you favor a student that it's endearing and very nice for them, but in fact it can be very uncomfortable and embarrassing for the student, right? So we have to kind of, when we're thinking about potential issues, understand the perception of the other person in that relationship. Imposing personal values on students. So we mentioned that in the vignette. I think you picked up on that in regards to giving thanks. Involving students in faculty and administrative controversies. Believe it or not, some of my clients who are students talk to me about how certain faculty talk to them about some issues that they have with other faculty. And it puts them in...
well, that's like just wrong.
Yeah, absolutely.
That's,
so it's, helping them.
Even talking to a student about another student.
Yes.
None of these things should ever
come up. But they do. So this is, hopefully, by this type of discussion, you can talk to others and see.
Or even if a student feels comfortable with one faculty member is having a problem with another, and comes to that faculty member and starts discussing the problems he's having with another faculty member, it's inherent upon the faculty member he's talking to guide them on how to help resolve it. You go to the other faculty member and approach that.
Right, that's professionalism.
Right,
that's role modeling. Absolutely. Simultaneously serving as teacher and health provider to a student, right? You mentioned that earlier.
Well, I have to be really careful with that because I'm in tight quarters with students in the clinic, and we'll see a patient, and then a student will, in the precepting area, start talking about their own personal health issues, and it gets really fuzzy really fast.
Wow. So any examples or kind of things that you do to help resolve that? Is there anything that
I steer them to you. I might leave the area. I feel like I can talk about generic stuff, but when it comes to a person's individual health issues, then I need to.
But if the person brings it up, there's nothing wrong with that.
It depends on what they're asking me to do. I have to check a question on the evaluation form that says I'm not providing health care.
Oh, well, I think that nobody should ever provide health care to a student, not if you're on faculty.
Right.
When I get called for a student that needs a GI consultation or a liver consultation, I refer them to another GI doctor.
You do automatically.
There's no question about that whatsoever. That's not a boundary that we can cross. So you can't do that.
Okay, good.
But I mean, if I'm with a group of students and one student starts talking about a digestive disorder or something they have and they ask my opinion, I have no problem saying, if I have a case like that, this is how I would approach it.
Sure, so that's more like mentoring or
exactly.
teaching, right?
But it's not me going to the student saying, hey, how's your diarrhea? Get rid of that constipation yet? But you feel better now. So.
And then, of course, dating of students, right? That's inappropriate.
What? Dating of students?
Dating of students. There have been instances, not here.
I know, but
from the literature.
But that's not even a boundary. That should be a law.
Absolutely, absolutely. So, what are the consequences of those potential issues? While special attention may be valued by a student, as I mentioned, it can be embarrassing. If students feel pressured to interact with a faculty member in a personal way, they may be reluctant to voice their concerns because of that evaluative process, which again causes the issues, and untold, right? They don't talk about these things. Students may initiate, so in terms of dating of students, based on what I've read, some students actually initiate a more intimate relationship in order to get, an end result. In fact, there was a student that I quoted.
It's no different than the workplace.
Yeah, that's true.
It's no different than the workplace.
There was a female psychiatric resident that once was reported, quote, "If I want to screw a teacher to get a better grade, I should have the right to do so," unquote. So we really, as faculty and staff, really need to be mindful of these relationships and setting those boundaries. And then dual relationships. Obviously, dual relationships for a clinical psychologist, meaning so you have a patient and all of a sudden they want you to walk, or the therapist, the psychologist asks them to walk the dog for them when they're out of town. So now there's a dual relationship. But as medical, what I'm understanding from the literature review, and you guys, I'm sure can vouch for this, there are dual relationships that exist in your field. And that's why those guidelines are not clear and consistent.
Give me an example of a dual relationship in our world.
They go to your church.
Right, or
you're
even,
on a-
or
Well, no, but that's not a dual
not go to your
relationship.
church. No, that's not dual. So
That's not a dual
if you work at, if you volunteer at the church, and now you're asking a student who you're evaluating
Volunteer.
to volunteer.
That's it.
That-
But going to a place of worship, anybody can go there.
Correct, absolutely. But again, so it's being mindful of how is this relationship, dual relationship, because it's outside of the evaluative
Right.
one, affecting the student and possibly affecting me as well.
That's like asking them to do personal things.
Correct, absolutely,
Yeah,
absolutely.
Okay, that's, I understand that.
So, ways to be proactive and mindful.
I have a quick question.
Yes.
Just because within student programs and student organizations, we have ones that are religiously affiliated, and then some faculty have come to me asking them like how should they approach like not recruitment but getting members of a group, because you can't be like, oh, I know that you are Catholic, or I know that you're Jewish, I know that you know certain things.
We try to recruit them into their faith.
Not into their faith, but like to get like larger numbers. So like someone will come to me like our group active members is very low. What are some ways?
My recommendation would be ask the students.
Yes.
Recruit.
That's what I always say. I was like, you need to reach out to
It's
the
not for the
president.
faculty
So it comes
advisor to
from
do the
up
recruiting.
here. Yeah.
Correct.
Remember our role, we are faculty advisors,
Yeah.
not faculty recruiters, or student recruiters, so that's,
Absolutely.
I always say to reach out to the students.
That's the
Yeah.
correct answer, absolutely. So some ways to be proactive and mindful. One, have these types of discussions more often, right? And not only with amongst yourselves, but also with students, because they need to be aware of those boundaries. Right? I don't think it's part of the curriculum, or is it? I'm not sure.
but these boundaries are also very important, because I'll see this with conflicts within faculty members. But we used to be close. I don't know what happened. And you try to guide them and saying, you guys, business is business. This is not where you become buddies with people, because if something happens, it's an effect of the professional environment.
But you're in Nelson.
They're going to do it anyways, which is okay, but they have to understand that there's consequences to that.
Yes, and maybe having those open discussions with them, right? In a group
I
setting.
mean, one of the top predictors of satisfaction in the workplace is whether you perceive that you have a friend at work.
Well, one thing's a friend at work, the other one's a friend that you do stuff with after work and you do all these other things. But, because what happens at work if there's a strain in that friendship relationship? Then work suffers.
No, absolutely. I mean, I'm saying, but I'm just saying it has ups and downs,
Yeah.
and that's.
I have no problems with friends at work.
It's the same.
It's after.
Right.
And I don't mind socializing with my peers. I just don't want it, I've always separated my professional life from my personal life. Even, when I was just doing medicine or when I was at I never, you can socialize with other professionals because it's part of the obligation. There's a cocktail party at the president's house. That's a social event, but it's part of business.
But like even that event would have boundaries. It
Oh,
is a
100%.
social event, but you're not gonna go and like get hammered.
Not get hammered.
You're gonna be very moderate. You may go, I'm not even gonna drink, 'cause I don't want anybody to see me drinking. You're gonna be on your best behavior.
I wish
But
to
it's
get drunk
still-
like when I get home.
You'll drink before you get there,
That's right.
and then you won't drink while you're there. But I think it's the same with work relationships. Is the same as faculty and student relationships. Is the issue of boundaries again.
Right.
You can definitely have good friends at work if you set those boundaries, and if people are in the understanding that work is work and we're here to work. We're not here to become like best friends forever. But if we do become very good friends, we still have to have that understanding that there is a work relationship that has to, and you can never. I think it comes when you start taking advantage of that work relationship that then issues arise. But if you still respect that person's position and take no when they say no and don't pull the friend card, but hey man, we were in the Keys last week. How can you not give me what I want? All right, it's the same for everybody. I think that, and again, it's the issue of boundaries, same as with your students.
Very good, thank you for sharing that. The next one, know the laws, ethical standards, local policies and practices, policies of HWCOM related to professional boundaries.
Oh, this is Miami.
Although there really are I looked at the faculty handbook to see what policies are in place, and there's very limited guidelines, right? And again, we talked about the reasons why.
I mean, we do have an explicit one now on not providing healthcare to students, which was
Right.
something that was partially done to amplify things for LCME.
Yes, that's right.
But that's about the only one that I can think of that's very specific to what we're talking about, beyond the student mistreatment policies that.
Yes, which are in place also due to the LCME or AA.
Yeah, pretty much in line
Yes.
with the LCME.
The next one, know the personal and situational risk factors for both professionals and students. So if you know that a student is needy, like there's some intuition about student behaviors, right? Are you going to then share your cell phone number with him or her?
It's in the syllabus.
It's in the syllabus,
It's in the
so it's there,
syllabus.
so it's there. Or are you
The
going
one
to be
thing they read in the
conveniently and emotionally available to that student as they approach you, every other day?
If it relates to their education and how they're performing, you need to be.
Okay.
Because if a student comes and says, listen, my family is breaking up, I have nowhere to go, I need this, I need that, what do I do? You can guide them in the right direction.
Choose the resources that are available.
Right, but you're not going to necessarily.
But if they come in and say, I need to talk to you because I broke up with, my significant other, I'm not the one to talk to about that.
Right, okay.
I think for me, one of the things that I wrestle with the most, because I'm an academic advisor, and so we're supposed to be having academic advising relationships with students, but not any kind of personal counseling relationships. Of course, the students we end up spending the most time with are the students who are struggling. And the students who are struggling are usually struggling for a set of reasons. And so I'm supposed to sit there and say, you really should go for counseling. You should think about going for counseling. You should think about accessing this and that and the other service. And of course, some of them do, which is all fine and good. But there's that other little group of students that continue to struggle, whether they're because of shame or whatever, they will not reach out. And I always have to hold myself back from kind of digging at them a little more so that maybe I could get them to say enough to say, see, you need help,
Because there is a guideline that what I'm hearing that you can't explore those things.
Yeah, we're told, most of us academic advisors actually grade students as well. So, we're really, at some point, if we haven't already, we'll be grading them. And I grade them my third year, not fourth.
Okay.
So it is important to respect that boundary.
Yes.
But it's difficult sometimes, because, when you have a learner in front of you who clearly could probably use things they're not getting, and may benefit from actually having someone push them hard enough to verbalize that, they have issues.
And the uniqueness with that in medical school is we are trained to help others.
Right.
So it becomes a line where you're saying, I see an individual that needs help, but in this position right now, I can just recommend you do this, you do that. I wish that you can't lead with those questions, even though that's how we're trained. That's in our hearts.
Right.
Absolutely. Thank you for that.
I was wondering if maybe, I think
Joe.
Joe.
That's what you're
Pretty simple,
saying.
3 letters, 2 vowels.
That's what you're saying.
In Spanish, it's Hoey.
Is that if you can't get them to speak about it and say, hey, so they can speak about it, you can say you need help. Maybe, I wonder, is it okay for example, you to reach out to them and say, hey, I think the student needs help, or does that make you feel like put you in an uncomfortable situation?
We have a very unique example here because we have such a strong Office of Student Affairs, which most medical schools do not. I was out, I'll tell you, the last 3 medical schools that I've lectured at have almost a 0 budget for student affairs. It's a very small little budget. It's for admissions, and everybody else is doing the stuff that's volunteering faculty members from other things. So we have a very strong, robust, and support for our students. Because as opposed to most other medical schools, the student's the most important thing here.
Right, so one thing is Dr. Von Harscher's new role as student support, you could actually refer or at least let her know about students of concern because she doesn't serve as a clinical, as a therapist, so she can reach out to the students based on her role, and hopefully they can then follow up with the necessary resources. So
And I
that's
wouldn't
nice.
be violating any confidentiality.
No, but I think what you would do is, the way I would do it, Carl, is I would tell the student, listen, do you mind if I give your name to?
Right.
And then do it.
I always experience people crying or being very sad, so I always go automatically to Dr. Von Harscher and I mention I saw so-and-so in the stairwell that was crying.
And the other interesting thing about South Florida are the multiple cultures we have. So in the Hispanic culture, it's okay to hug somebody or give them a kiss, which I found out when I went to Gainesville in 1973. That was not a North Florida custom. You know, because here, you know, when you're a little boy, you know, Hispanic boy,
You're very physically affectionate with everyone.
Yes.
which I found very interestingly, because when I was in Northern California, the Hispanics of Northern California are not that
Are
way
not
at
that
all.
way.
In Southern
Right.
California, they were.
Yes.
So I mean, I thought it was like a normal Hispanic thing. You just, you know, you kiss somebody on the cheek. I kissed my son, not on the cheek. But it's, you know, there's also cultural things. The other
Yes.
cultural things that we need to acculturate faculty that comes down here, particularly from the Northeast,
Yes.
is that the cultures of South Florida tend to talk very loud. And it's not in a sense being rude. It's just, that's the way,
They are.
Yeah.
you know.
Yes.
So we need to understand within these boundaries that where we think somebody crossed a boundary, and they might have, and you have to understand the cultural background behind it, and then make sure that you twist that in as you're teaching the boundaries.
Yes, maybe we can have a workshop where we, you know, put in diversity and cultural aspects in relation to healthy boundaries.
Absolutely.
Thank you for that.
Thank you so
Thank
very,
you.
very much. Thank you all for attending. And just to
Thank
remind
you.
you, August 16th, our next session. Thank you very, very much.
Thank you.